Hello everyone. In this session, we are going to discuss the important topic that is endometrial hyperplasia. So in your university exam, you usually get a short question on one of the three types of endometrial hyperplasia, that is simple hyperplasia, complex hyperplasia with atypia, or complex hyperplasia without atypia. But rarely you can get a long question of overall endometrial hyperplasia, so you have to write down the histopathology of all three types. Here you can see we are starting it. So before understanding the endometrial hyperplasia, you must understand the three layers of the uterus. I will be discussing the topic under following headings. First, I will let you know the definition of endometrial hyperplasia. What do you mean by that? Then I will let you know its pathogenesis. Then we will see the clinical significance. What are the clinical features? Then we will see the ultra important, 5-star important, the classification of endometrial hyperplasia. We divide it in three categories. Simple hyperplasia without atypia, complex is without atypia, complex with atypia. And we have to see the histopathology image of all three. And then we have to see the risk of malignancy in each of them. So if it is coming as a long question, you have to frame your answer under following headings. And if it is a short question, whatever is asked, one of them, you have to write that point only. So let's start it. So before understanding what is endometrial hyperplasia, you must understand what is endometrium. So basically in the female reproductive tract, the uterus is the organ. The uterus have three layers. Can you see the three layers of the uterus? You can see the innermost layer of the uterus is endometrium. This is endometrial lining, the innermost layer. The middle layer of the uterus. Can you see here this one? The middle layer of the uterus, the thickest layer, this one is myometrium. This one is myometrium, the middle layer. And the outermost layer is perimetrium, that is serosa only. The perimetrial serosa, perimetrium is there. So these are the three layers of the uterus. I would like to show you a video also. Have a look. Please appreciate the three layers. You can see this is uterus. You can appreciate the three layers. So I want you to appreciate this is the endometrium, this is perimetrium, and the thicker one, the middle one is the myometrium. So please appreciate the thickness. The thickest layer is the myometrium. You can see that in this video also. You can see this is endometrium, this is myometrium, this is perimetrium. So I hope you appreciated the three layers. Now among the three layers, the innermost layer, that is endometrium or endometrial lining, is shedded every month. In a healthy adult female in reproductive age group, the endometrial lining is shedded every month in the form of the menstruation, menstrual bleeding. So every 28 days, it's a physiological phenomenon, that is menstruation, in which the endometrial lining is shedded. Now the next 28 days, it is reformulated, it is built up. And in the next cycle, it is shedded again. So it's a cyclic process that is known as menstruation. I guess everyone knows that. You can understand and you can see it here. Now the endometrial lining, which I'm telling you, the endometrial lining, which is shedded into the menstruation, it is having two components in that. The endometrial lining, can you see here? The endometrial lining is having two things. Number one, glands, and the background is the stroma. Can you appreciate the background? The background is the stroma. See in the diagram. So there is glands and there is stroma. So endometrium is having two things. The endometrial lining, the endometrium, which is shedded in the menstruation, it is having two things, the gland and the stroma. And there is the particular ratio between the gland and the stroma. So that is normal ratio, you can see. So now with this normal understanding, let's start the topic endometrial hyperplasia. What is endometrial hyperplasia? So endometrial hyperplasia is increased proliferation of glands related to the stroma in the endometrium. So I told you the gland to stroma ratio is very peculiar. You can see gland versus stroma. Now here the glands will increase so much. They will increase in number. The glands, but stroma is not increasing in that proportion. So increase in number of glands related to the stroma. Stroma is not increasing, but glands are increasing. So it is known as increased gland to stroma ratio. Increased gland to stroma ratio, because glands are increasing but stroma is not increasing. So numerator is increasing, denominator is not increasing, so overall ratio will increase. So this is endometrial hyperplasia. So this is the definition of endometrial hyperplasia, because of which the endometrial lining become thickening, and it will lead to abnormal uterine bleeding. So can you see here the first uterus? I want you to appreciate the endometrial lining. This is the endometrial lining. It is having normal gland to stroma ratio. So you see the thickness. Now see the second uterus. In front of you, you can see a diagram of the second uterus in which the glands are increasing disproportionate to stroma. So it is increasing the thickness of the endometrial lining. And I told you endometrial lining is something that is shedded every month into the menstruation. So here the menstruation is normal. So this thickness only is shedded. And here the thickness is high, you can see. So here the female will bleed heavily during menstruation, or she can bleed between two menstruations also. That is known as abnormal uterine bleeding. That is the biggest symptom which is seen in endometrial hyperplasia. So what is the definition? Can you tell me what is endometrial hyperplasia? Can you define endometrial?